Today we are going to discuss about biomechanics in orthodontics. When we consider the development of the craniofacial skeleton and dentition, it is subject to number of alterations in the mechanical forces acting in the vicinity of the craniofacial skeleton and dentition. These alterations in normal mechanical forces will lead to an abnormal development of dentition and craniofacial skeletal structures. That means when we have a facial deformity or a dental malocclusion or a skeletal malocclusion, whatever it is, an abnormal muscle force is acting behind its development. So, the main influencing factor in the development of craniofacial skeletal deformity is nothing but an abnormal mechanical force. So, in order to treat a malocclusion also, whether it be a dental one or a skeletal one, we need to apply mechanical forces. That means, development of a craniofacial skeleton can be affected, or we can put it another way. Development of craniofacial skeleton can be influenced towards positive side by applying normal mechanical forces, or its abnormal development can be arrested by applying an opposing forces. So ultimately, the mechanical forces are the things, or the mechanical forces are the ultimate factors that are influencing the development of a normal craniofacial skeleton. So the understanding of fundamentals of mechanics is very much essential to understand the clinical problems in orthodontics and management of these orthodontic problems. Now, what is the term biomechanics means? It's nothing but application of the mechanical principles to biology is called as biomechanics. Let us know about the basic terminologies pertaining to the biomechanics. Force, moment and couple and the moment to force ratio are the basic terminologies that we should be familiar in order to understand the mechanical principles underlying the orthodontic treatment. Let us discuss about one by one. What is a force? Force is nothing but an act upon a body which will tend to halt a moving body or which will tend to move a static body. That means it's nothing but a force is nothing but an external component which influences a structure which might be at rest or in motion to alter its present position. So that is called as force. The force has a magnitude. Increasing the amount of force will have an increasing movement of a body in a increasing movement of a free body which is not resisted by other external factors. When we take the same principle of increasing the magnitude of force in case of orthodontic tooth movement, it's an hypothetical question whether this increased force is going to increase the rate of tooth movement or decrease the rate of tooth movement. It depends upon the biological response of a particular individual, the pliability or the moldability of the bone in which the teeth are embedded. That means when we consider a free body and we apply a force on that body, there is no restraining factors that are going to influence the effect of the magnitude of force. Whereas when we consider a tooth or a group of teeth, they are embedded in the strong periodontium, which will act as a resistant factor to the influence of magnitude of force. This is a small difference that you should understand. That is pertaining to magnitude. Now, what about the point of force application? Before entering into the effect of point of application of force on the tooth movement, we have to understand about certain terminology like center of mass, center of gravity and center of resistance. What is center of mass? When we consider a free body, okay, like a body in a space, its entire mass is concentrated at some point within its body. This is called as center of mass. What is center of gravity? Suppose we consider a free body under the influence of gravity. It has the point within its body where the ultimate gravitational force acts. That means center of mass in a gravity environment is called as center of gravity. So the center of mass, center of gravity and center of resistance both are similar terminology, but their applicability depends upon the environment in which the body is located. What is center of gravity? Here is the example wherein the tooth or any body for that matter is under the influence of gravity. That means the point is resting with center of gravity as the fulcrum. What is center of resistance? As I told you, center of resistance is nothing but a point that is present within the body where the entire resistance offered by the structures around it is concentrated. Okay. So, these are the three basic terminologies. Now, what are their effect on the type of movement? When we apply an external force, and if that force is acting through either the center of mass or center of gravity or center of resistance, depending upon the situation in which the body is present, a body will move in a translatory fashion. That means each and every point on the body will move at a same rate and to an equal distance in a provided period of time, provided that the effective force acting on that body is passing through either of these 3 points, depending upon the environment in which the body is present. So these 3 are not different points. If a body is present in free space, it is called a center of mass. If a body is present in a restricted or restrained environment, then the point where the entire mass of the body is concentrated is called as center of resistance. Whereas if a body is present in a gravity environment but not under the influence of any restraining factors, then the point where the entire mass of that body is concentrated is called as center of gravity. Provided that the net forces are acting through either of these points, the body will move in a bodily fashion or a translatory motion, wherein each and every point on the body will be moving at the same rate to a same extent in a given period of time. You can clearly observe in this slide that when we consider a tooth which is embedded in its socket, the center of gravity is present in the root with more coronally, because much of the mass of the body, mass of the tooth is concentrated more towards the crown end. Whereas when we consider the center of resistance for the same tooth, it is present almost in the middle of the root. That means when a body is present in a restrained environment, the location of the point through which the force should act to move it bodily will be different from the location of point through which, if the force acts, the body will move in a translatory fashion if the body is present in an environment where gravity is present. So here you should keep in mind that in order to move a tooth bodily, the force acting on it or the resultant of multiple forces acting on that tooth should pass through the center of resistance. Now, what is a moment? Moment is nothing but a tendency of a body to rotate is called as a moment. When we apply a force to the body which is away from the where the point of application of force is away from the center of resistance, then the body will experience a tendency to rotate. That means the body will experience a moment. So a moment is nothing but a rotational tendency of the body. In orthodontics, this moment is expressed as rotation, tipping or torquing, depending upon the type of tooth movement that the moment is going to bring about. Now, what are the factors controlling a moment? As I told you, moment is a rotational tendency. Here the point of force application will be away from the center of resistance. From this we can calculate a moment as force times the distance between, or force times the perpendicular distance between point of force application and center of resistance of a body. So as we increase the force, keeping the point of force application constant from the center of resistance, the moment will increase. That means moment of force is directly proportional to the force applied provided the distance is constant, or the moment of force is directly proportional to the distance about which the force is acting provided that the force is constant. What is the center of rotation? If we apply a force at certain point away from the center of resistance on a tooth, the tooth will rotate. That means the long axis of the tooth is going to change. When we intersect or when we draw long axis of the tooth before its movement and after its movement, both the long axis will meet at a point. This is called as point of intersection, and it is called as center of rotation. Now, as I told you, applying a force away from center of resistance will lead to rotational tendency. Now, depending upon the distance of the force application also, I told you the moment is going to differ. So, if we apply a force which is very far coronally to the center of resistance of a tooth, or very far towards the crown tip, then the moment created will be high and the tooth will have a tendency to rotate in a clockwise direction. And when this happens, the crown will rotate in one direction whereas the root will rotate in another direction. This is called as uncontrolled tipping. So in an uncontrolled tipping, the force is acting too much away from the center of resistance and the root is moving in one direction whereas the crown is moving in opposite direction due to the moment created by force. This is called as uncontrolled tipping. If the same force is applied such that it passes more through the portion of the tooth which is closer to the center of resistance, then also we have a moment created, but its intensity is very much less when compared to the moment that is produced when we apply a force away from the center of resistance, very much away from the center of resistance. This force which is acting relatively closer to the center of resistance will also create a moment, but the root apex of the tooth will be stable and only crown will be moving in an opposite direction. So when we draw a long axis of the tooth before movement and after movement, these two long axes will intersect at root apex of the tooth. This type of tooth movement is called as controlled tipping, where we have a movement of only crown portion towards the direction of force application, whereas the root apex will remain relatively stable. Usually uncontrolled tipping happens with removable appliances, whereas controlled tipping will happen with fixed appliances. Now yet we have one more type of tooth movement, that is the root movement. When we apply a force which is more apical to the center of resistance, then the tooth root will move with crown relatively stable. That means when we draw a long axis of the tooth before movement and after movement, then the point of intersection of the two long axes will be at the crown tip. Now this type of tooth movement is called as torquing or uprighting, wherein root will move leaving the crown relatively in a stable position. Now one major doubt is, does all these things happen at a time, or they will happen at specific periods of time of force application? Now let me clarify you. Whenever you apply an orthodontic force to a tooth, definitely it will be away from the center of resistance. There is a provision for taking force of orthodontic appliance closer to the center of resistance, but we can't take it through the center of resistance. So in response to these forces, we have the creation of moments as well as forces. So combination of this tipping and torquing will lead to ultimately bodily movement. That means as the force decreases, moment increases. Okay. Now this increasing moment will cause increasing tipping of the tooth, but due to presence of archware in the bracket, a moment which is opposite to the direction of moment created by the force applied will be created, leading to movement of the root. That means root will move first, and in response to the moment generated due to the arch wear, root will move. So crown will move, root will move. In this manner, tipping and torquing happens, which will ultimately lead to the bodily movement or translation of a tooth. Now once a tooth is translated, when we draw a long axis of the tooth before the movement and after the movement, they both will never intersect, and then the center of rotation is said to be present at the infinity. So these are the different types of tooth movement in relation to the point of force application, which will be either more towards the center of resistance or away from the center of resistance coronally, or away from the center of resistance apically. That was about moment of force. Now what is a couple? Couple is nothing but two equal and opposite forces acting in a non-collinear fashion. That means both are not acting in the same line. Their magnitudes are same, but their points of application are different, and they act in an opposite direction and not in a same line. So those are two opposite, equal, non-collinear forces. Now, when we apply this couple, one force acting on one side of the center of resistance and another force acting on other side of the center of resistance in an opposite direction, this coupled force will create a rotational tendency with center of rotation equal to the center of resistance. Okay. Now, the two forces will be additive. Sorry, the two forces will create two moments which are additive. The forces will cancel out each other, but the moments cause rotation of the body. This is called as pure rotation. So, if two forces are acting at opposite sides of center of resistance, or both the sides of center of resistance, then the effect of the two moments will be additive. If the two forces are acting on the same side of the center of resistance, then the effect will be negative. Let us see in this example. So here in the first image, you can see that the forces are acting on either side of the center of resistance, which will create two moments whose effect is additive in a anti-clockwise direction. In the second image, wherein the couple is provided, or the two forces are acting on the only one side of the body, that means towards only one side of the center of resistance, then the effect of the moments created will be subtractive. That means the body will tend to rotate in the direction in which more force is applied. Sorry, in the direction in which the effective moment is present. And this is one more explanation of additive effect and subtractive effect of the coupled forces. You can just clearly notify that in the first image, you can see the moment created by one force and the moment created by another force is additive, leading to a larger moment, whereas in the second image we have a moments in two directions. So the body will ultimately rotate in the direction in which the moment is more. This is called as coupled forces. The next important terminology in biomechanics is moment to force ratio. It is nothing but the ratio of counterbalancing moment produced to net force that is applied to a tooth. Now let us have an example. In order to retract the incisors, we will apply a force at the level of crown. This force tends to move crown lingually and rotate the tooth. This is called as moment, which is produced in a clockwise direction. When you look into this image, we will be having arch wear in the bracket, isn't it? So when we apply a force to the tooth, which will tend to retract the force, it will create a clockwise rotational tendency, whereas the twisting of the arch wire within the bracket will create a counterclockwise moment in a tooth. So the twisting of the arch wire will create a couple that will tend to move the root lingually. So the moment created by force applied at the level of crown will try to pull the tooth lingually, whereas the counterbalancing moment created by the coupled force generated by the archware in the bracket will tend to move the root lingually. It is the ratio of this counterbalancing moment produced by the archware coupled force to the force that is applied to retract the teeth, that is called as moment to force ratio. Now, the moment in a clockwise direction produced by the applied force on the crown will be balanced by the counter moment created by the coupled force produced by the archware in the bracket. So when these moments cancel out each other, there will be a translation or bodily moment or bodily movement. Got it right? Force creates a moment, whereas the couple created by the archware in the bracket will create a counter moment. When the counter moment is equal to the moment created by the force, then the tooth will move in a bodily fashion. If the counter moment is more than the moment created by force applied, then the root will move. If the counter moment is less than the moment created by force applied, then the tooth will move in a tipping fashion. Let us look these examples in the following slides. Here, this is an uncontrolled tipping. Force is acting at the level of crown, which is creating a moment in a clockwise direction. This will cause tipping movement. Now, here we have a force acting at the level of crown creating a clockwise movement, whereas a counter moment is being created due to the archware. So the net effect will be difference between the moment created by force and the counter moment created by the archware in the bracket. If the moment created by force is more than the moment created by or the counter moment created by the archware in the bracket, then the crown of the tooth will move in the direction of force, keeping the root in a relatively stable position. Now, what is translation? As I said you earlier, if the moment created by force and the counter moment created by the archware balances each other, then the tooth will move in a bodily fashion. So we have yet another moment called as root moment, where the counter moment created by the archware in the bracket is more than the moment created by the force that is applied, which will lead to movement of the root alone, leaving the crown in a stable position. That means we have a net 4 types of orthodontic tooth movement. One is tipping, wherein crown will be moving in one direction and root will be moving in opposite direction, and the movement of crown will be in the direction of force. Number 2 is, that's an uncontrolled tipping. Number 2 is controlled tipping, wherein only crown will be moving in one direction, leaving the root apex stable. And the third type of the movement is translation or bodily movement, where each and every point on the body or each and every point on the tooth will be moving at the same rate and to a same distance in a given duration of time. And the fourth type of movement is torque movement, where only the root will be moving in the direction of applied force or moment, whereas the crown will be relatively stable. So these are different types of tooth movements and different terminologies pertaining to basic biomechanics in orthodontics. Understanding of these terminologies and these types of tooth movement are essential to comprehensively evaluate the movements that occur in a dentofacial skeleton in response to applied orthodontic force. Now, we have one more kind of tooth movement that is called as rotation. See, tipping is also comes under rotation, but here rotation, which I mean to say is movement of tooth along its own axis. Okay, when we see a tooth occlusally, movement of tooth either mesial in or distal in or mesial out or distal out is called as a pure rotation. So the long axis of the tooth will be the axis of rotation. So that was our today's discussion on basic biomechanics, the terminologies, their application to the dentition and different types of tooth movement. Still important topics will be covered in our upcoming classes. Thank you.